let's talk about children and dentistry. What advice do you have for young moms or not so young moms who just had a baby, maybe the first, otherwise they probably know. Anyway, what should they take care of? When should they bring the child to the dentist? Is there things they should do or not do while the child is growing and having teeth and stuff like that?
All right, well, first of all, I just want to add a little something to what you said. Even if it's not the first, they may not necessarily have done the right thing on their first child, if this is their second or third or fourth child, and maybe it was just luck that got them through the situation. And maybe each child that I've learned, having 4 children of my own, each child is different, and you might be lucky with one, but the second one, you may not be lucky with when it comes to having a problem. So no matter which child it is that you've had, the first time, there's been some different theories on this and changes and everything, but the first time you should bring a child into the dentist is usually 3 to 4 months after the appearance of their first tooth in their mouth. Now, the average child gets their tooth, the average person gets their first tooth at about 6 months old, which means that before their first birthday, you should see a dentist with your child. Your child should see the dentist, but you obviously have to bring them in because their feet can't reach the gas pedal on the car. So you bring them in at that point, and there's some very important things that are looked at, and there's some very important things that are discussed with the parent who's going to be taking care of this child, through those dentally formative years. So it's very important. That first visit should be before they're 1 year old.
Yeah. Well, obviously, not obviously, but it doesn't look like there's lots of work to be done there. So it's more like looking, checking, getting the child comfortable with the dentist. Is that all part of the role of bringing them in early?
Well, at that age, you're not doing anything on a conscious level. That doesn't really start happening till about 3.5 years old. At 3.5 years old, you can have a relationship as a dentist directly with the child. Prior to that, the relationship is more with the mother and the child together, and then at the very early ages, prior to the 1 year and around the 1.5 year mark, the relationship is more with the parent, with the mother or the father. The father can be bringing them in, of course, but with the parent and the child actually being secondary. You can check to see position of things, and you can explain certain things about the gums and about the tongue, about the cheeks, about the lips, different things that they need to know about the muscles that are attached inside the lip to the gum area. There's a lot of technical things that we can point out, but it's more of things that the parent does as far as generally taking care of the child.
Right. But what about at home?
One thing.
What about is something you want to say?
Yeah, I was going to say the one thing that's very important, and I know raising children, it's a very easy thing to want to do, is you don't want to put the baby to sleep with a bottle. Because even though you're not giving them, say, apple juice, you're not giving them something with sugar in it, even if you're giving them milk or formula, but I don't want to get into the formula thing, but let's say, whatever you're giving them, once they fall asleep, they lose that swallow reflex. So they have one last mouthful of whatever they're drinking in their mouth all night long. And that material in the mouth, with the enzymes of the mouth, the digestive enzymes that we have in our saliva, will break down and will start to decay teeth. And that decay will become rampant at an early age like that. And those teeth will be terribly destroyed because of a habit that was started when they didn't have teeth, so there really wasn't a problem to think about. But once you get that child into that mode, it's very hard to get them out of the mode. So if they're in the mode where they're getting something at night to sleep, then the first thing you want to do is, if you can't get them away from the bottle, then just get water in the bottle. And then the water will do no damage, and then they'll have the bottle to fall asleep with. And then eventually they'll reach an age, 2 or whatever, right, 1.5, when you can take it away totally. But that is the most destructive thing we see with children nationwide, is that bottle syndrome, where the teeth basically just rot. And I mean rot. And there's nothing worse than having a patient come in who's 3 years old that you have to put totally to sleep with an anesthesiologist and have to take out all of the roots of their teeth because of a parent that just didn't know that's what caused it. It's very, very sad. It really is.
Well, it makes sense. After all, we learn to brush our teeth, right, before we go to sleep, and ideally even throughout the day when we eat. So why would one soak one's teeth in and yes, milk has, creates enzyme, turns sour, has sugar no matter what. I guess that applies also for people, moms breastfeeding and letting them stay there too long, right?
Right. It's just any liquid that's going to have a lactose in it will break down into a lactic acid and will break down into sugar. Yeah.
Right. So obviously that avoids apple juice, apple juice and orange juice, because sometimes people are not. I see it, with some of the health people I talk. Apparent health people, alternative health and stuff, and oh no, I don't, I don't eat sugar, and then they buy a bottle of orange juice from the store, and when I show them that thing has just about as much sugar in than a Coca-Cola, they go, so, yeah. All right, I got it. Thanks a lot. Beautiful,
okay,
beautiful information. Beautiful information. Thank you.
Okay, you're welcome.